Hi friends, welcome back to my channel Only Bio. Presenting up the MCQs from the chapter Circulation. So let's solve from 26 to 30. I hope you have been following the series. The structure of the heart, the external as well as internal, has already been explained long back. So please do check with the playlist. Your suggestions and comments are most welcome. And study with me and get ready for all the competitive exams as well as your board exams. Question number 26. What is the reason why fluid is forced out of systemic capillaries at the arteriole end? A. The osmotic pressure of the interstitial fluid is greater than that of the blood. B. The osmotic pressure of the interstitial fluid is greater than the hydrostatic pressure of the blood. C. The hydrostatic pressure of the blood is greater than the osmotic pressure of the interstitial fluid. D. The hydrostatic pressure of the blood is less than that of the interstitial fluid. And the correct answer for this question is C. So the reason why fluid is forced out of systemic capillaries at the arteriole end is the hydrostatic pressure of the blood is greater than the osmotic pressure of the interstitial fluid. Very simple, because it's at a higher pressure, and we know that the solvents or the liquids tend to flow from higher pressure to the lower pressure. Question number 27. Which of the following is not a normal event in the process of blood clotting? A. Activation of prothrombin to form thrombin. B. Production of erythropoietin. C. Adhesion of platelets. D. Conversion of fibrinogen to fibrin. And the correct answer for this question is B. Production of erythropoietin. That's a hormone which is produced by the kidneys in case of hypoxic conditions, that is low oxygen condition, which stimulates the bone marrow cells to produce more of RBCs. So this is not at all the event of blood clotting. Question number 28. Blood clotting is prevented by the presence of dash. A. Vitamin K. B. Calcium ions. C. Heparin. D. Thrombin. And the correct answer for this question is C. Heparin. You know, heparin is the anticoagulant. It prevents the blood clotting when the blood is flowing within the body. Question number 29. Which of the following carries blood rich in food matter such as glucose and amino acids from the intestine to the liver? A. Dorsal aorta. B. Mesenteric artery. C. Renal portal vein. D. Hepatic portal vein. And the correct answer for this question is B. Hepatic portal vein. So the hepatic portal vein carries blood rich in food matter such as glucose and amino acids from the intestine to the liver. Question number 30. Spleen is dash. A. Hemopoietic organ. B. Lymphoid organ. C. Reproductive organ. D. Celluloid organ. And the correct answer for this question is B. Spleen is a lymphoid organ. It's a part of the lymphatic system. Friends, here you're likely to be confused in between option A and option B. So let me clarify. Spleen is not a hemopoietic organ in case of adults, but it stores the RBCs and releases them in the blood as and when it is needed. Also, it is the center along with the liver for hemolysis, and that's the reason it's called as a graveyard of RBCs. When the bone marrow is not yet developed, it is in the earlier stages of life. At that time, the spleen does help in hemopoiesis, but that's only a temporary phase. In the majority of our lifespan, it's basically a lymphoid organ. So the correct answer here is lymphoid organ, and it is involved in the production of antibodies. That is, it is a part of immune system, you may say. Friends, I'm sure the series will help you. If you're new to the channel, please do subscribe and check with the playlist for the other chapters as well. Thank you. Keep studying.